Here's this nurse who's fabulous and who has many, many years of education and in the health field, and she's telling me she's fine. But yet there's, something's telling me that this isn't fine.
Ellie Raj had happened upon her longtime friend Mary Alice Stamm in a neighborhood park. While they were talking, Ellie started to become concerned, but Mary Alice, a retired nurse, thought her friend was overreacting.
But she's slurring and incoherent, and she didn't like me saying those words because in her mind, she was completely normal. She wasn't in pain. She didn't realize when she was speaking, what she was saying sounded right to her in her mind, but it just wasn't coming out exactly the way it should be.
And I remember I thought I was talking very normal, but it was garbled.
Mary's daughter, herself a nurse, suspected a stroke when told of the symptoms. They immediately called 911. At a nearby hospital, doctors determined that Mary Alice needed advanced stroke care. They called UT Southwestern's stroke hotline, a critical call that set off a chain reaction of team-based care.
UT Southwestern being an advanced comprehensive stroke center, we offer this higher level of care 24 hours a day, 7 days a week, every day of the year.
Minutes after Mary Alice arrived at Zale Lipsche University Hospital, her medical team got to work. Doctors reviewed her imaging,
Mary,
while stroke coordinator Mandy Derrickson did an assessment.
I raised her left arm, and I didn't even get the word one out of my mouth, and then it just hit the bed.
Doctors needed an alternative to IV TPA, which is routinely used to dissolve clots in the brain. Mary Alice was not a candidate since she was on blood thinners. Her best option for not leaving the hospital with serious disabilities? An invasive procedure using a mesh tube to ensnare and then remove the blood clot in her brain.
It was, I think, 32 minutes from when she landed till she was on the table and they were doing the procedure, so really quick.
Interventional radiologist Dr. Lee Pride performed the procedure. It was a success.
So she was able to get the procedures that she needed by the experts who were on the staff here, and she had a great outcome.
Dr. Pride was able to remove the blood clot in Mary Alice's brain.
Can you raise up your hands?
Sure, both of them.
And soon, her symptoms had almost disappeared.
From the stroke coordinator, Mandy, to the nurses that took care of her, to the doctors, the surgeons, post-care, the ICU nurses, the nurses on the floor, it was great. It was flawless. They did an excellent job. Look at her.
Mary Alice can barely believe what she had almost lost.
When I watch it, I think how blessed I am. I was just really blessed that everybody did what needed to be done.
I could have lost my mom, and my kids could have lost their grandmother. By having this procedure, by us living in an area next to a UT Southwestern, they gave me my mom back.